This is Billy, a 26-year-old type 1 diabetic, back in the clinic after yet another stay at the local hospital for acute hyperglycemia diabetic ketoacidosis. You have seen him only once before to refill some prescriptions, but other providers at the clinic know his story and shake their heads when he comes in repeating the same old story. Billy does not like managing his diabetes and has refused all treatment at times, always with disastrous consequences. This last time he spent 10 days in the hospital, several of them in the ICU, and nearly died.
Hey,
Oh, hey, Billy, how are you?
I'm whatever. What do I need to do?
Do you want to see a doctor today?
Yeah.
Alright, I'm gonna need you to fill out this paperwork.
Do I really have to? I've done it like a million times before.
Yeah, but it's a new day, so please fill it out.
Okay. Thanks. Here's my paperwork with my insurance information. Oh, my back and feet are killing me. Can you get the doctor any faster?
Let me go over this and I will call you as soon as possible.
Okay.
That's it.
Ugh, I don't want to be here. The last time I was here, I almost died. It was so scary and no one was here to support me. All the doctors just told me how bad of a patient I was, how I was the cause of my own suffering, and insinuated that I didn't deserve to help.
Alright, thank you. What do I have next?
Guess who's here? Billy, your frequent flyer.
Oh, great.
Have fun.
Alrighty. I'm too busy for this. He always comes in for the same stuff. But I guess we'll deal with it.
Approximately 10 hours later.
Alright, Billy. You ready?
Thank God, it's about time.
Alright, let's go. So, I see your back and feet hurt. And you were at the hospital not so long ago. How was that?
It was pretty bad. I almost died.
Oh, I'm sorry to hear that.
Yeah.
Alright, so have you been managing your diabetes at all?
I mean, I like sort of at like a minimum. Like I really don't like to.
Alright, let me check
So.
this.
Just like a lot, and like I have other problems to worry about.
Just relax here. Alright. What are you here for today though? What's your like main concern? Just your back and feet?
Yeah, I really just want like a refill on the medications I had, and I was sort of hoping to like talk about maybe methadone because it's helped me before, and clenopsin, something like that. I don't remember.
Alright. Let me take your temperature. Doesn't look too bad. And we're gonna check your glucose levels.
I don't.
No? You don't like that?
No.
I'm sorry, we have to check it though. Okay, and I'll go check on that. So we have Billy today. Pretty sure you know him. Here's his chart.
Thanks. I'll look into it.
Yeah, he's probably back for some payments, so.
Today we're going to be learning about type 1 diabetes. Type 1 diabetes is a chronic autoimmune condition that makes the body unable to produce insulin, which is the hormone that regulates blood sugar. Without insulin, our bodies can't use the sugar in our bloodstream as energy, so that causes people to experience diabetic ketoacidosis. Diabetic ketoacidosis occurs when there's an overload of glucose in the bloodstream and no glucose is being able to be taken up into the cells, so that causes the cells to starve.
Hi, Billy. I'm your doctor today, Dr. Scott. Can you tell me what pain you're experiencing today?
Yeah, my feet have been really hurting, and my back's been really hurting, and I haven't been really able to manage my anxiety for my bipolar depression.
Can you elaborate on a scale of 1 to 10? What do you feel?
6,
6?
Yeah.
With 10 being the most extreme pain ever?
maybe 7.
7?
Yeah, it's pretty bad.
And where do you normally feel this pain?
Like my back, like it's so deep and it like won't go away, and my feet, it's like pins and needly sort of, and it's
Has it ever woken you up from sleep?
yeah. Sometimes if I turn over wrong or something, and like I don't really have like a nice bed or anything, so like that's yeah.
Yeah. I'm sorry to hear that. We'll see what we can do for you today. You're gonna totally manage your pain.
Thank you.
Oh, when were you diagnosed with bipolar depression, Billy?
I think I was probably like 15, and I'm
Oh.
26 now.
I hear you were diagnosed with diabetes too. Can you tell me more about that? How you've been dealing with that?
Yeah, I'm sort of dealing with it. I have type 1 diabetes, and I was like probably pretty young. I don't really remember exactly when I got it, but I haven't really been handling it just because it's like sort of the least of my problems right now.
Mm-hmm.
Yeah.
Do you feel if you've been able to like function with the mental illness and diabetes at the same time?
No, I think that's something I really struggle with, and two, I think that's why I was hoping to get some methadone
Mm-hmm.
because I feel like the last time I was on it, it really helped me focus more and take care of myself better.
And you came here today for Klonopin too, right?
Yes.
Why did you come up with that drug?
I think because I heard like around that's really good for anxiety, and I can't do anything right now. I'm like not really functioning that great.
Okay, well, while taking into considerations what you want, and we can come together and make a plan. I think there's a good chance Billy's telling the truth about his chronic pain, as it is very common in patients with diabetes, but I definitely want to treat it in a way that won't contribute to his addiction or have much potential for abuse. I think a downside of treating Billy's pain is his history of drug abuse, because I am less sure of the balance between the amount of harm I'm doing versus the amount of good. I think an upside may be that I have to be more careful with prescribing and hopefully be able to avoid further potential for abuse, but I have to make sure that it doesn't worsen his diabetes. With that, I think I'm going to treat his chronic pain first, since that's his chief complaint, then his bipolar depression, and then his diabetes. Before I consider giving you any treatments, I need to ask you a couple questions before. Are you a regular smoker?
No.
Have you done any hard narcotics lately?
Yeah.
Do you know which ones?
Yeah, I've used methamphetamine and lately heroin.
Are you trying to quit?
I know it would be like better for me to stop, but I'm definitely like it's like really helping me deal with like my bipolar disorder.
Do you feel supported in your home?
No, I don't really have a home because I'm homeless.
I thought you went to a home group. It says in your history that you go through a home group.
Yeah, sometimes, but it's like there's like some issues with it for staying after a certain amount of time, so you can't stay there like forever.
Okay. Are you interested in learning on other support groups for drugs?
Yeah, I think I would be.
I think I want to manage his pain and his bipolar disorder at the same time so that he can have a better chance to control his diabetes and to help him keep off the street and on insulin. I'm thinking amitriptyline is great as it can help with both anxiety and chronic pain, so if he only takes this pill, he will have a better chance of going straight. I'm not willing to give him narcotics because I think alternatives are better. Norepinephrine is a good one. It can help him deal with his addiction, but is much safer for diabetics than methadone. Oh, duloxetine too, because it can help stop the progression of his neuropathy. Then his symptoms won't get worse, hopefully. Okay, this is a good plan because the interactions between anti-anxiety tranquilizers and narcotics isn't safe for the environment he's in. Do you drink any alcohol recently?
Yep.
Okay. Do you do that on a daily basis?
It sort of depends on what's around.
Will you be willing to quit alcohol completely?
No, probably not.
Dang, I really like Dr. Scott because he actually talks to me. Usually I just feel talked at. He wants to make this like a team effort and is respecting my boundaries, and he doesn't act like he knows what's best for me or that he knows my life better than I do.
Because it might worsen your bipolar depression? And because it has a really life-threatening effect with alcohol consumption. And the other medication that you came for, methadone, has a complication with your diabetes because it causes hyperglycemia in your body. And I don't really think these drugs that you came here for really fit your lifestyle. So I'm thinking of different treatments that can maybe like complement your quality of life and not be so negatively affect you. If that makes any sense.
Yeah.
Yeah.
I know this is a dumb question, but like, what is hypoglycemia?
There's no dumb questions, Billy. And hypoglycemia is
Hypoglycemia is a condition caused by having a very low level of blood glucose in comparison to an individual's target range. This can be caused by some things like taking too much insulin, skipping a meal, or exercising a lot. And that, class, is hypoglycemia.
That's hypoglycemia.
That's the first time I've really understood. Thank you, doctor.
No problem. Anytime, Billy. Based on the physical exam, it seems that your symptoms are more in line with neuropathy, but I sent some lab tests for you just in case there's any other complications with your diabetes. But I was wondering if you had any questions about what I just told you.
Yeah, I have one question. What is neuropathy?
Neuropathy, or also known as peripheral neuropathy, is a result of damage to the nerves outside of the brain and spinal cord, also known as your peripheral nerves. This often causes damage or weakness and numbness and pain, which is usually found in your hands and your feet. It can also affect other areas of your body. And that's neuropathy.
And that's neuropathy. I think taking prescriptions are the only demands I can make of Billy, such as his request for him to follow whatever treatment plan is prescribed in order to best manage his concerns. I think my ultimate duty to Billy would be to try to help him address his chief complaints and then try to come up with the next step plan to help him get his other conditions under control. I think it's important to focus on the things he would like to focus on, as he may feel more heard and possibly be more open to working on or follow-up goals after the appointment. Maybe a potential compromise that could be used is that if he starts with his treatment plan and doesn't work out, he can come back to reevaluate his conditions, but most importantly, I should try to make it clear that this is a team effort so he doesn't feel alone in this. Plan, Billy, I would like to prescribe you duloxetine for your neuropathy because it will stop the progression of your neuropathy and it would help with your pain. And I think that's a double awesomeness that you'll really enjoy. And I want to prescribe you in-depth for your bipolar depression and your chronic pain because it's a two double-edged sword. So fix it up. So you'll have to take less pills because I don't want you to be taking too many. I also want to prescribe you buprenorphine because it'll help address your addiction and it'll be much safer for diabetics than methadone. And do you have any questions or concerns with my treatment plan?
Right now I don't have any questions, but thanks for asking.
Oh, okay, Billy. I would like to plan a follow-up in 2 weeks to see your progression, and maybe then you can come and ask me some questions that you might be feeling with your prescriptions. And also, I want to just let you know that you can come in anytime if you have any complications before this 2 weeks. And just tell the front desk that you want to see Dr. Scott, and I'll make time to see you.
Aw, thank you, Dr. Scott.
It was very nice meeting you, Billy.
It was really nice meeting you. Thanks for listening. I appreciate having a doctor I feel like cares about me.
Anytime.
Da-na-na.
Hey.
Oh, no, wait. I should be doing something else. I'm just waiting for.
Doesn't tell me.
Oh, when?
Next, I'm going to ask you something. Damn it.